Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And, as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time...
Oh, I'm gonna go get some tasty waves, bro.
So you've come up with a lot of options, but I know you've heard about this so many times about people who go to a surgeon and they're ready to operate one, immediately, and they don't offer other options.
It's tough, right? You're going to a surgeon because that's their specialty, right? And so they are trying to help you. Everything's changed. Nowadays, industry and the amount of things we can fix with discs and everything is pretty simple, and the risks are low. So a surgeon's gonna say, well, I see a bad disc on the MRI, I can fix that. But there's always a downside to doing a surgery because you're gonna change something within the spine. You're either gonna change the muscles, whether scarring within the muscle, you're gonna change the mechanics of the spine. If you can enhance your body's own healing capacity before you ever get to that surgeon, you're gonna be better off.
Yeah, I was actually speaking to one of my family members about their surgical process, and I said, look, it's not as simple as you're just getting a new tire, right? Surgery is more of a, you have to try to really think about what you can do preventatively to work towards your goal, and if you can't achieve that, it's not like surgery is going to give you superpowers. It's actually going to set you back before it sets you forward, right? So kind of talking through the logistics of surgery in general, I think is really important for others to know when is it the right time for you.
I know as people get older and they start running, some people say it's not a good idea to run because it's a lot of stress on your back. Would you recommend people run for exercise?
I think running is not necessarily inherently bad for the back, but if it hurts you, you've got to evaluate that a little bit. If you're feeling that jolt every time, it's probably not the best thing. You want to go with more low impact exercises.
Yeah, me and running, I do not like it. It hurts my back. That's why I use the elliptical. That's the way to go.
What about swimming, though? That's a great exercise.
Yeah. That is terrific. Swimming has the benefit of, because you're buoyant, not having the effect of gravity on you. But the caveat to that is that swimming doesn't allow the amount of stress that your body needs to build bone. So that the body builds calcium around those joints to build up muscle and bone strength.
Wow, that's fascinating. I happen to have osteoporosis. Now I'm very careful. I know what to do. I do a lot of weight-bearing exercises.
Vitamin D, eating well, you're going to build up bone.
Since we're on the topic of ailments, so now I have degenerative arthritis on my neck. I got diagnosed that back in my 30s.
First of all, it's a very, very common condition. As a matter of fact, almost everybody gets it, right? It's almost like a wrinkle, right? You can't avoid it. So what you want to be doing to counter that is to increase the flexibility of your joints and keep working on the core strength. Your ear, remember, your ear is supposed to line up with your shoulder if you're looking at yourself from the side. And most people are forward a lot in the way in which they hold their neck. And so that puts a lot more pressure on your discs. That's going to make it degenerate further.
So I was going to ask you a question of when is it appropriate to seek, a medical expert advice for back pain? What are the telltale signs of something else is wrong and you need maybe a treatment to intervene?
That's an excellent question. It's very commonly asked. And it's important in both ways to know when is the right time to push for more interventions. Like, for example, you have your bout of back pain after a week or two, you don't need to get x-rays. The vast majority of that's going to heal up. The times that you want to be concerned about back pain is if it's associated with numbness or weakness down your legs, bowel or bladder problems, if there's any night sweats or unexplained weight loss, these can be an indication of an underlying infectious problem or some kind of other problem that could be serious. If it becomes chronic, if you've had chronic recurrent pain for months on end, that's when it's important. So those are great questions, very important to know those factors.
Where does stem cells play in a part in any of this? As something that's crossed my mind.
Well, across a lot of people,
Yeah,
right?
like-
Because you want the benefit, the perceived benefit of stem cells is you're using a cell that's going to change and morph
Right.
into a disc cell, for example, or is going to change your degenerative disc disease to make it better all of a sudden. It's in the early stages. So meaning that I wouldn't all of a sudden jump and think that you can get a stem cell that's going to reverse your degenerative disc disease, because stem cells can also cause a lot of other problems. So you want to wait until the true studies come out comparing stem cells versus what we call a sham injection, some kind of injection inside the disc. And so far, it's very promising, I could say that, but it's not definitely something that
It's
you
still
should
in its
jump
infancy.
Yes.
Okay.
The surest bet is using your own body's recuperative capacity.
Right.
So one of my favorite things to do when I have a tight back is I kind of put my hands like this. My boyfriend comes behind me and lifts me up and cracks my back, and it feels so good. Is that something that's good for your backs? Because I know that the kind of, doing the hands, it's might
we're
cause
cracking
more
our knuckles.
arthritis. Is that similar? I know. Is that similar to cracking your back?
You actually, that the fear that cracking your knuckles or things are going to cause arthritis is not founded. There's some good research that says that that's not a problem. That's number one. So that's for your joints and your fingers. But as far as your back is concerned, actually, it's very helpful, what you just said. I do this to my kids all the time. I walk behind them, give them a bear hug, pop, 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 pop.
So good.
You could do it to yourself by lying on a foam roller, letting it relax back, lying on a foam roller down the center of your back. That also helps, and you'll feel that, because what you're doing is you're counteracting that force of gravity that's gradually pulling you down in your back, pulling you forward. And what happens is, as it gets stiff there, those joints in the back get stiffer and stiffer. You want to straighten those up by putting that, by loosening those joints. And that pop is a little vacuum that forms inside the joints that you're releasing. So you want that range of motion. It's good for you. Obviously, don't force it to the point where it hurts, but.
Who knew? Both my son and daughter cracked their back, and I always say, that's not good for you. I'll have to take that back.
So do you find that your practice, as it has evolved as a surgeon, has kind of gotten a little bit closer to a holistic approach on back pain, and almost a little closer to maybe even chiropractic?
I don't know about that. I think that the thing I feel most strongly about is that most of the treatments that are healthy for your back are not passive ones. I think passive ones like cracking have a little tiny sliver of importance in your back. It's mainly the strengthening of the muscles that are important. And not just, when you talk about core muscles, we're not talking about the belly six-pack muscles. We're talking about the core muscles, like the ones obliques on the side of the back, the ones in the back of the back. Those are the ones that you want to strengthen. I'm not into the passive treatments. I'm into these active treatments. I think those are the ones most beneficial. When you have pain, you want to blame it on a certain biologic thing going wrong, like a disc going bad. Back is not like that. It's really a biopsychosocial model. What's my mindset? What are my thoughts that keep going on? What's my social, stresses that are going on? If you don't affect all these things, you're not really dealing with your back pain.